During a resuscitation event, the AED advises no shock advised. What should the rescuer do next? A. Turn off the AED and end resuscitation. B. Deliver rescue breaths only. C. Recheck the rhythm manually. D. Continue compressions immediately for 2 minutes. Answer: D. When the AED states no shock advised, the patient is usually in asystole or PA. The correct step is to resume high-quality CPR immediately for 2 minutes before reanalyzing the rhythm. Stopping compressions reduces perfusion and survival rates. A patient collapses suddenly in a hospital hallway. The pulse is absent, and the AED pads are applied showing VF. What is the correct first action? A. Administer epinephrine immediately. B. Deliver 1 shock and resume CPR. C. Check for a pulse again. D. Wait for advanced airway insertion. Answer: B. In ventricular fibrillation, the priority is early defibrillation. 1 shock should be delivered, followed by immediate CPR for 2 minutes before reassessing. Each second of delay lowers the chance of survival. What compression to ventilation ratio is used for 2 rescuers performing CPR on an infant? A. 30:2. B. 20:2. C. 5:1. D. 15:2. Answer: D. In 2-rescuer infant CPR, a 15:2 ratio allows more frequent ventilation, matching the infant's higher metabolic oxygen needs while maintaining cardiac output. Which of the following indicates high-quality CPR in an adult? A. Compression rate of 80/100/min. B. Full chest recoil between compressions. C. 4-second interruptions for ventilation. D. Shallow compressions to avoid fatigue. Answer: B. Full chest recoil ensures that the heart refills with blood between compressions, improving circulation and coronary perfusion. Even slight leaning can reduce blood flow by up to 30%. During BLS for an adult with an advanced airway, what is the correct ventilation rate? A. 1 breath every 5 to 6 seconds. B. 2 breaths every 15 seconds. C. 1 breath every 8 seconds. D. 2 breaths every 10 seconds. Answer: A. When an advanced airway, ET tube or supraglottic, is in place, continuous compressions are given while providing 1 breath every 5 to 6 seconds without pausing compressions. A patient with a pulse becomes apneic. What should you do? A. Start compressions. B. Begin rescue breathing. C. Apply AED immediately. D. Wait for pulse to stop. Answer: B. If a patient has a pulse but isn't breathing, rescue breathing should be started, 1 breath every 5 to 6 seconds for adults, while reassessing the pulse every 2 minutes. In which case is it acceptable to withhold CPR? A. Obvious signs of rigor mortis. B. Absence of a pulse. C. AED advises no shock. D. The patient has no breathing. Answer: A. CPR should be withheld only in irreversible situations like rigor mortis, decapitation, or valid DNR orders. Otherwise, it must begin immediately when there's no pulse. Which action improves survival most in out-of-hospital cardiac arrest? A. Rapid 4 access. B. Early defibrillation. C. Early airway management. D. Epinephrine within 10 minutes. Answer: B. Early defibrillation within the first 3 to 5 minutes can double or triple survival rates for shockable rhythms like VF and pulseless VT. What is the primary purpose of capnography during CPR? A. Detect hypoxia. B. Verify endotracheal tube placement. C. Measure CO2 to assess compression quality. D. Identify metabolic acidosis. Answer: C. End-tidal CO2 monitoring helps assess CPR quality. A value below 10 mm of mercury often means poor compressions, while a sudden rise above 40 mm of mercury may indicate return of spontaneous circulation, ROSC. How should compressions be performed on an infant using the two-thumb encircling hands technique? A. Thumbs at nipple line, compress 1/3 chest depth. B. Index fingers over sternum, ½ inch deep. C. One thumb below nipple line, compress 1/4 chest depth. D. Thumbs at upper chest with firm grip. Answer: A. The two-thumb encircling hands method provides better compression depth and stability. The chest should compress about 1/3 its depth, 1.5 inches. What is the most reliable indicator that a rescue breath is effective? A. Air escapes through the nose. B. Chest visibly rises. C. Victim coughs. D. You hear gurgling sounds. Answer: B. Visible chest rise confirms that air entered the lungs. Lack of rise may indicate airway obstruction or improper seal. During CPR, you notice the chest isn't recoiling fully. What's the best correction? A. Compress faster. B. Lift hands slightly off the chest after each compression. C. Apply more downward force. D. Pause every 15 compressions. Answer: B. Allowing complete recoil helps the heart refill. Even minor leaning reduces venous return, lowering cardiac output. What is the correct order of the adult BLS survey? A. Check responsiveness, activate, help, check breathing, check pulse, begin CPR. B. Check pulse, start compressions, call for help. C. Check breathing, place in recovery position, activate, help. D. Start compressions, attach AED, call for help. Answer: A. The proper BLS sequence ensures early recognition, activation of EMS, and initiation of CPR in correct order to maximize survival. A child suddenly collapses at school. You're alone and have no phone. What should you do? A. Perform 2 minutes of CPR, then activate EMS. B. Leave immediately to call for help. C. Check pulse every 10 seconds. D. Wait for another responder. Answer: A. For a lone rescuer with a child victim, perform 2 minutes of CPR before leaving to call EMS, as pediatric arrests are often asphyxial. What is the compression depth for children? A. 1 inch. B. 1.5 inches. C. About 2 inches. D. 2.5 inches. Answer: C. The chest should compress about 1/3 its depth, roughly 2 inches for children, to generate adequate perfusion pressure. If an advanced airway is placed, how often should you reassess the pulse? A. Every 30 seconds. B. Every 2 minutes. C. After 5 ventilations. D. Only when AED prompts. Answer: B. Once an advanced airway is established, continuous compressions are maintained, but pulse checks should occur every 2 minutes to assess for ROSC. During resuscitation, a patient suddenly regains a palpable pulse but remains apneic. What is your next action? A. Continue compressions. B. Apply another AED shock. C. Check rhythm. D. Stop compressions and start rescue breathing. Answer: D. Once ROSC occurs, chest compressions stop, and assisted ventilations continue until the patient resumes spontaneous breathing. When using a bag mask device with 2 rescuers, what is the best technique? A. One rescuer performs both tasks. B. One holds the mask using EC clamp while the other squeezes the bag. C. Alternate breaths every 15 seconds. D. Inflate bag quickly and firmly. Answer B. The two-person bag mask technique ensures a proper seal and effective ventilation. One rescuer seals the mask, while the other provides breaths. In which situation should the recovery position be used? A. Unconscious, breathing victim with a pulse. B. Unresponsive and pulseless. C. Apneic with no pulse. D. After AED shock. Answer A. The recovery position maintains airway patency and prevents aspiration in unconscious but breathing victims. What is the most common cause of cardiac arrest in children? A. Ventricular fibrillation. B. Congenital heart disease. C. Respiratory failure or shock. D. Hypothermia. Answer C. Pediatric cardiac arrest is usually secondary to hypoxia or shock, therefore, effective ventilation is crucial in pediatric resuscitation. What is the most reliable indicator of effective chest compressions during CPR on an adult? A. Audible clicking sound from the chest. B. Visible rise of the chest. C. Palpable carotid pulse with each compression. D. Minimal interruption in compressions. Answer C. Feeling a carotid pulse with compressions confirms that the heart is being adequately compressed to create artificial circulation. It's the best indicator of effective perfusion during CPR, more reliable than visual or auditory cues. When performing CPR on a patient with an advanced airway, how should compressions and breaths be delivered? A. 30 compressions followed by 2 breaths. B. Continuous compressions with 1 breath every 6 seconds. C. 15 compressions followed by 2 breaths. D. Alternate compressions and breaths every 5 seconds. Answer B. Once an advanced airway is placed, compressions should be continuous at 100-120/min without pauses, while ventilations are delivered every 6 seconds to maintain oxygenation. During two-rescuer infant CPR, what is the correct compression to ventilation ratio? A. 15:2. B. 30:2. C. 5:1. D. 10:1. Answer A. Two-rescuer infant CPR uses a 15:2 ratio to improve ventilation frequency since infants have higher oxygen demands compared to adults. If a defibrillator is unavailable, what should rescuers do after delivering 2 minutes of CPR? A. Check for a pulse. B. Administer rescue breaths only. C. Continue CPR until a defibrillator or advanced help arrives. D. Stop and reassess the scene. Answer C. Continuous CPR without interruption sustains minimal blood flow to the brain and heart until a defibrillator or ALS team can provide definitive care. Which step should be performed immediately after defibrillation? A. Check the rhythm. B. Resume CPR starting with compressions. C. Check for a pulse. D. Give 2 rescue breaths. Answer B. CPR should resume immediately after a shock to circulate oxygenated blood. Rhythm or pulse checks are done only after 2 minutes of compressions. Which statement is correct about chest recoil during CPR? A. Full recoil allows better coronary perfusion. B. It increases fatigue in the rescuer. C. Recoil is less important than depth. D. Recoil only matters for pediatric patients. Answer A. Allowing full chest recoil permits venous return to the heart, which is critical for maintaining blood flow during compressions and improving survival. What is the first step if you suspect an opioid overdose and the person is unresponsive but breathing? A. Start chest compressions immediately. B. Call emergency services and administer naloxone. C. Deliver 2 rescue breaths. D. Place in supine position and wait. Answer B. For opioid-related emergencies, calling for help and giving naloxone promptly can reverse respiratory depression before full cardiac arrest develops. The main purpose of the AED's analyzing function is to A. Identify the type of arrhythmia present. B. Deliver a shock automatically. C. Record data for post-resuscitation review. D. Measure chest compression rate. Answer A. The AED analyzes the heart rhythm to determine if it's shockable, like VF or pulseless VT, ensuring shocks are only delivered when beneficial. When using a bag mask device for ventilation, how should two rescuers coordinate? A. One rescuer seals the mask while the other squeezes the bag. B. Both alternate every 10 breaths. C. Each rescuer uses their own mask. D. One holds the airway while the other monitors pulse. Answer A. The two-rescuer technique improves oxygen delivery. One maintains a tight mask seal, while the other provides consistent ventilations. During CPR, what is the ideal compression rate per minute for all age groups? A. 90 to 100. B. 100 to 120. C. 120 to 140. D. 80 to 100. Answer B. Research shows that compressions between 100 and 120 per minute optimize coronary perfusion pressure without causing excessive fatigue or inadequate depth. What is the correct hand placement for adult chest compressions? A. On the lower half of the sternum. B. Above the nipple line. C. Directly over the heart apex. D. On the left side of the chest. Answer A. Compressions on the lower half of the sternum generate direct pressure over the ventricles, maximizing blood ejection during compressions. What should a rescuer do if an adult victim has a pulse but is not breathing? A. Begin compressions. B. Give one rescue breath every 5 to 6 seconds. C. Deliver 30:2 CPR cycles. D. Place in recovery position immediately. Answer B. Rescue breathing supports oxygenation when spontaneous circulation exists but respiration has ceased. Check pulse every 2 minutes. What is the preferred defibrillation energy for biphasic AEDs in adults? A. 100 joules. B. 120 to 200 joules. C. 300 joules. D. 360 joules. Answer B. Biphasic defibrillators require lower energy for effective shocks. 120 to 200 J is the recommended range, depending on manufacturer guidelines. What is the best method to relieve choking in a conscious adult? A. Chest compressions. B. Back blows. C. Abdominal thrusts. D. Finger sweep. Answer C. Abdominal thrusts increase intrathoracic pressure to expel the obstructing object from the airway effectively in responsive adults. Which situation requires high-performance team CPR? A. Single rescuer with no AED. B. Multiple trained rescuers coordinating tasks. C. Bystanders performing hands-only CPR. D. Pediatric victims only. Answer B. Team-based CPR improves efficiency by dividing tasks like compressions, ventilation, and AED use, minimizing interruptions and improving survival. During infant choking, what is the correct action if the infant becomes unresponsive? A. Start chest compressions and check the mouth before breaths. B. Perform back blows continuously. C. Wait for emergency help. D. Deliver 2 quick rescue breaths only. Answer A. When unresponsive, begin compressions to dislodge the obstruction, then check the mouth before giving rescue breaths. What is the primary goal of post-cardiac arrest care? A. Prevent rearrest. B. Restore normal breathing. C. Stabilize hemodynamics and prevent brain injury. D. Deliver additional shocks. Answer: C. After ROSC, maintaining oxygenation, blood pressure, and brain perfusion is critical to prevent further neurological damage. Which statement about rescue breathing for infants is true? A. Each breath should last 2 to 3 seconds. B. Give one breath every 3 to 5 seconds. C. Deliver 10 to 12 breaths per minute. D. Chest should rise slightly with each breath. Answer: D. Only gentle puffs are required for infants, enough to see visible chest rise without causing gastric inflation. If a patient has a tracheostomy tube and requires ventilation, how should the rescuer proceed? A. Seal the mouth and nose. B. Ventilate through the tracheostomy opening. C. Perform mouth-to-mouth breathing. D. Use chest compressions only. Answer: B. Ventilations are given directly through the tracheostomy opening since it bypasses the upper airway. Which action improves CPR quality during long resuscitation efforts? A. Frequent rescuer rotation every 2 minutes. B. Maintaining the same rescuer for consistency. C. Shorter compressions with faster rate. D. Delaying ventilation to prevent fatigue. Answer: A. Switching rescuers every 2 minutes prevents fatigue, maintaining proper depth and rate throughout CPR efforts. What is the best indicator that rescue breaths are effective? A. Audible air entry. B. Visible chest rise. C. No air leak from mask. D. Return of spontaneous pulse. Answer: B. Chest rise signifies that air is entering the lungs and not the stomach, confirming effective ventilation. When using an AED on a child under 8 years old, what is recommended? A. Use adult pads only. B. Shock with maximum energy. C. Delay use until EMS arrives. D. Use pediatric pads and dose attenuator. Answer: D. Pediatric pads reduce shock energy to a safe level appropriate for a child's smaller heart and body mass. What is the most common cause of cardiac arrest in infants and children? A. Myocardial infarction. B. Respiratory failure or obstruction. C. Electrocution. D. Trauma. Answer: B. In pediatric cases, cardiac arrest is typically secondary to hypoxia from respiratory failure or airway obstruction. What should rescuers ensure before shocking with an AED? A. Everyone is clear of the victim. B. Pads are dry. C. Oxygen is turned off. D. All of the above. Answer: D. Safety is crucial. No one should touch the patient, pads must adhere properly, and oxygen should be moved away to avoid fire risk. What is the correct action after ROSC is achieved? A. Immediately stop all interventions. B. Place the patient in recovery position and monitor. C. Provide oxygen and monitor vital signs. D. Begin another round of compressions. Answer: C. After return of spontaneous circulation, maintaining airway, breathing, and circulation ensures stabilization until advanced care continues. Which of the following increases survival chances in sudden cardiac arrest? A. Early defibrillation and high-quality CPR. B. Immediate medication administration. C. Rapid 4 access. D. Chest X-ray. Answer: A. Survival depends primarily on quick CPR and early shock delivery to restore organized cardiac rhythm. What is the correct action if an AED advises no shock advised? A. Resume CPR immediately. B. Reanalyze after 10 seconds. C. Check for a pulse and stop compressions. D. Turn off the AED. Answer A. CPR should continue for 2 minutes before the AED reanalyzes rhythm, maintaining perfusion in non-shockable states. Why is minimizing interruptions in compressions critical? A. It prevents air trapping. B. It maintains coronary perfusion pressure. C. It allows rescuers to rest. D. It stabilizes airway pressure. Answer B. Even brief pauses drop perfusion pressure drastically, reducing chances of successful defibrillation and survival. What should you do if the victim is submerged in water and needs defibrillation? A. Shock immediately. B. Dry the chest area before applying pads. C. Remove the victim from water completely. D. Apply pads underwater. Answer B. The chest must be dry for the AED to function safely. Water can cause current dispersion and ineffective shock delivery. Which CPR action has the greatest impact on survival and out-of-hospital cardiac arrest? A. Early, high-quality chest compressions. B. Use of airway adjuncts. C. Administration of drugs. D. Early hospital transfer. Answer A. Studies confirm that uninterrupted, high-quality compressions are the single most critical factor improving survival rates in cardiac arrest cases.